Hi, good morning, doctors. Today we are on our 31st day of reading Oxford Handbook of General Practice. I am Dr. Sesha, your study buddy, and we are preparing together for MRCGP AKT exam. We are at page number 556, chapter 15, Neurology, Neurological Assessment Skills. A number of neurological assessment scales are in common use. Agreeing to use a formal validated assessment scale enables comparison of observations between different team members and also allows comparison of observations over time. Commonly used scales are Glasgow Coma Scale, GCS scale, assess the level of consciousness, given in page 1052. Motor scoring scale, assess the muscle power. So for consciousness, Glasgow Coma Scale, and for assessing the muscle power, motor scoring scale, it is 0 is no muscle movement, 1 is muscle flicker but no movement, 2 moves but not against gravity, 3 is supports the limb against gravity but not against resistance, 4 is able to overcome mild resistance, mild weakness, 5 is able to overcome strong resistance or normal power. So this is motor scoring scale. We usually use this for describing muscle weakness. Disability severity scales assess the impact of a particular condition on the individual. These scales are usually condition specific. Example, the Migraine Disability Assessment Scale (MIDAS) or a seizure severity questionnaire for patients with epilepsy. So disability scales, this is my MIDAS scale, Migraine Disability Assessment Scale or seizure severity questionnaire for patients with epilepsy. These scales are useful to gauge the severity of symptoms and also monitor response to any treatments provided. Daily living skills. A number of scales are available that measure the individual, what the individual can do in practice. These may be non-disease specific like Barthel Index or disease specific Oxford Stroke Handicap Scale. It is not really important which scale is used as long as everyone in the team uses the same scale for any given patient. Most use a graded Likert scale, graded Likert scale 0 to 5 and rate activities such as mobility, walking stairs, ability to transfer, personal care, dressing and washing, feeding, ability to prepare food, ability to feed the self, toileting, ability to use the toilet, continence, bowel and bladder. So this is a graded Likert scale, 0 to 5 grading is there. Quality of life scales. Neurological conditions can have a profound impact on the quality of life. Scales used to assess impact on quality of life may be completed by the patients themselves or by attending health professional. Examples include non-disease specific is EQ, Euroqual EQ5D, Euroqual EQ5D scale. This is non-disease specific scale and a disease specific scale like quality of life in essential tremor Quest, quality of life in epilepsy, QOLI. These are the two scales, Quest and QOLI. Cognitive function test. Example, the General Practitioner Assessment of Cognition, GPCOG, or Cognitive Impairment Test, 6-SIT. 6 Cognitive Impairment Test, 6-SIT. These are given in page 989, Cognitive Function Test. Mental health scales. So, for anxiety, you have GAD-2 scale, and for depression, you have PHQ-9 scale. Migraine Disability Assessment Score or MIDAS score, used to assess the impact of migraine on symptoms on lifestyle. Migraine symptoms on lifestyle. Instructions. Please I'll answer the following questions about all the headaches you ever had over the last 3 months. If you did not do the activity in the last 3 months, write 0. On how many days in the last 3 months did you miss work or school because of your headache? Number of days. You have to write how many days in the last 3 months was your productivity at work or school decreased because by more than half because of your headaches. Do not include days you counted in question 1 where you missed work or school. On how many days in the last 3 months do not do household work because of your headache? So for all these questions, you have to write the number of days and you should not include the days which you have included in the past question. How many days in the last 3 months was your productivity in the household work decreased by more than half because of your headaches? Do not include days you counted in question 3 where you did not do household work. On how many days in the last 3 months did you miss your family, social, leisure activities because of your headaches? number of days. Mida score total is dash days. On how many days in the last 3 months have you had a headache? If the headache lasted more than 1 day, count each day. On a scale of 0 to 10 on average, how painful were these headaches? 0 is no pain at all and 10 was pain as bad as it can be. Questions A and B, these are last two questions were A and B. And the questions A and B measure the frequency of migraine and severity of pain, and they are not used to reach the MIDA score but provide an extra information helpful for making treatment decisions. Interpreting the MIDA score, score 0 to 5, minimal infrequent disability, tend to have little or no treatment needs, can often manage with OTC medication. If infrequent, severe attacks may require a triptan. Score 6 to 10, mild or infrequent disability, may require medication for acute attacks, example an NSAID plus an antiemetic or a triptan. Score 11 to 20, means 11 to 20 days you had this problem of migraine. Moderate disability will need medication for acute attack and consider prophylaxis. Consider other causes for headache, example tension type of headache. Score less than 21, severe disability. Unpaid work such as household work, shopping and caring for children and others is what was included in this score. That is household work. That's all for the neurology chapter. Now we are in the chapter dermatology. So doctors, we will start the chapter dermatology in another video. So I'll end this video here and the next video will be about dermatology. Thank you. Have a good day.